If you live in a state where abortion access is restricted or banned, you may be wondering how to get cheap and accessible birth control pills to prevent unwanted pregnancies. One option is to use online services or apps that can prescribe and deliver birth control pills to your door or a nearby pharmacy. Here are some steps to find and use these services. First, you need to check if your state allows online prescriptions for birth control pills. Some states require an in-person visit with a doctor or a nurse practitioner before you can get a prescription. You can find out the laws in your state by visiting the website of the Guttmacher Institute or the National Conference of State Legislatures. Next, you need to choose an online service or app that suits your needs and preferences. There are many options available, such as Nurx, Lemonade Health, PRJKT Ruby, Pill Club, 28, Simple Health, Planned Parenthood Direct, Alpha, and Wisp. Each service has different features, such as the types of birth control pills they offer, the cost of the pills and shipping, the insurance coverage they accept, the consultation process they use, and the availability in different states. You can compare these services by visiting their websites or reading online reviews. Once you have chosen a service or app, you need to create an account and fill out a questionnaire about your medical history, current medications, allergies, and preferences for birth control pills. Some services may also require a photo ID and a blood pressure reading. Depending on the service, you may also have to chat with a licensed medical provider who will review your information and write you a prescription. This may take a few minutes or a few hours. After you get your prescription, you need to choose how you want to receive your birth control pills. Some services will ship them directly to your door in discreet packaging, while others will send them to a pharmacy of your choice where you can pick them up. Some services may also offer automatic refills and reminders so you don't run out of pills or miss a dose. Finally, you need to follow the instructions on how to take your birth control pills correctly and safely. You should start taking them on the first day of your period or on the first Sunday after your period begins. You should take one pill every day at the same time until you finish the pack. Then you should start a new pack after a 7-day break or immediately if you are using continuous or extended cycle pills. You should also use a backup method of contraception, such as condoms, for the first 7 days of taking the pills or if you miss a pill or vomit within 2 hours of taking it. Using online services or apps can be a convenient and affordable way to get birth control pills in states with abortion bans. However, you should also be aware of the possible side effects and risks of taking birth control pills, such as nausea, headaches, mood changes, blood clots, and reduced effectiveness if you take certain medications or supplements. You should also consult your doctor if you have any questions or concerns about your health or contraception options. There are many types of birth control pills available, and they can have different effects on your body and health. Choosing the right one for you depends on several factors, such as your medical history, your lifestyle, your preferences, and your goals. Here are some steps to help you compare and choose the best birth control pill for you. 1. Know the two main types of birth control pills: combination pills and progestin-only pills. Combination pills contain both estrogen and progestin, which are hormones that prevent ovulation and thicken cervical mucus to block sperm. Progestin-only pills only contain progestin, which mainly works by thickening cervical mucus. Combination pills are more effective than progestin-only pills, but they also have more side effects and contraindications. 2. Consider your medical history and risk factors. Some conditions or medications may make certain types of birth control pills unsafe or less effective for you. For example, if you have a history of blood clots, stroke, heart disease, breast cancer, liver disease, migraine with aura, or smoking over 35 years old, you should avoid combination pills. If you have a history of ectopic pregnancy, ovarian cysts, breast cancer, or irregular bleeding, you should avoid progestin-only pills. You should also check with your doctor if you are taking any other medications that may interact with birth control pills, such as antibiotics, anticonvulsants, antiretrovirals, or herbal supplements. 3. Think about your lifestyle and preferences. Different types of birth control pills may have different effects on your menstrual cycle, mood, weight, acne, libido, and other aspects of your well-being. Some people may prefer a pill that reduces their bleeding frequency and severity, while others may prefer a pill that keeps their cycle regular and predictable. Some people may experience mood swings, nausea, breast tenderness, or headaches with certain pills, while others may not. Some people may find it easier to remember to take a pill every day at the same time, while others may prefer a pill that has a flexible window of time or a shorter placebo week. You should weigh the pros and cons of each type of pill and decide what matters most to you. 4. Compare different brands and formulations of birth control pills. Within each type of pill, combination or progestin only, there are different brands and formulations that vary in the amount and type of hormones they contain. For example, some combination pills have a fixed dose of hormones throughout the cycle, monophasic, while others have varying doses, biphasic or triphasic. Some combination pills have drospirenone as the progestin component, which may help with acne and water retention but also increase the risk of blood clots. Some progestin-only pills have desogestrel as the progestin component, which may prevent ovulation more consistently than other progestins but also increase the risk of ovarian cysts. You should compare the different options and see which one suits your needs and preferences best. 5. Consult your doctor or healthcare provider before starting any type of birth control pill. They can help you assess your medical history and risk factors, prescribe the appropriate pill for you, explain how to use it correctly and safely, monitor your response and side effects, and adjust your dosage or brand if needed. They can also answer any questions or concerns you may have about birth control pills or other methods of contraception. Remember that birth control pills are not 100% effective at preventing pregnancy, and they do not protect against sexually transmitted infections, STIs. You should always use a condom or another barrier method along with your pill to reduce the risk of pregnancy and STIs.